Hi, very good evening. First of all, do confirm these two things. Is it streaming fine? And second, is my voice clear? Or do you want me to raise my voice? Hi, Ramya. Hi, Meghanshu. Hello. Akshaya, Kushbu, Akriti, Arunima, Forum, Paveen, Kalpana, Monica, Karishma, Sahana. Hi, a very good evening. So today we'll have a live discussion on a few important points relevant to the subject pathology. So keeping those points in mind, I have framed some multiple choice questions and I have even posted them in our Google and WhatsApp group. I hope you have gone through those questions. So we'll briefly discuss those questions and relevant points pertaining to those questions. And once we complete the session, we'll have a new session with a small street walk because it's comparatively less cloudy today. So I'm sure you can have a look at the mountains and the beautiful lakes here, and along with that we'll just have a small street walk, right? I hope you guys are ready. Okay, streaming is fine. You want me to raise my voice? Sure, because I'm afraid that if I raise my voice, the neighbors might get disturbed. Maybe because of that concern, I'm trying to put my voice as a minimum as possible, but anyways, I'll consider. Yes, I'll raise the voice. Okay. So we'll start with our first question, right? So the first one, which of the following is the most common form of necrosis? So often we have several questions from the topic necrosis. Different types of necrosis, examples, the pathophysiology. So which of the following is the most common form of necrosis? Coagulative necrosis, caseous necrosis, liquefactive, all of the above. So which of the options would you choose? The most common type or form of necrosis. View is perfect. That's glad to hear. We're going to have street view a bit later, and I'm sure you'll enjoy the view. It's awesome. Yes. Yes. So necrosis, any kind of injury, any kind of ischemic condition, so any foreign material or any infective agent has a potential to cause infection, inflammation, and a sequelae of events. So necrosis as such is a very vast topic which we discussed in detail, and the examples, as I said, are very important. So the most common type of necrosis among the given options is coagulative. And we have few characteristic features of coagulative necrosis which are the most important. First of all, it's because of ischemia and also infarction. Ischemia is decreased blood flow which can potentially lead to infarction. Infarction is death of a tissue because of compromised blood flow and oxygen flow. And also, along with that, other characteristic features include protein denaturation. The most important thing, as you all know, is preservation of tissue architecture. The cell outline or the architecture is preserved. That's why we have this characteristic tombstone appearance, if you remember. So tombstone appearance is also a feature of coagulative necrosis. And the area of infarcts are triangular in appearance based on the gross view, and the best example which you can give is myocardial infarction, right? So coagulative necrosis is the right answer. Yes, Snigdha, definitely, I'll help you out. You can just drop a mail for any details regarding any trip which you're planning to. I'll definitely guide you in that aspect as well. Okay. So we'll have our second question. I hope I'm audible, right? Let me know if you want me to still raise my voice. Okay, second question. I've given you matching. Match the following. So on one column you have pycnosis, karyorrhexis, karyolysis. On the other side of the column you have nuclear shrinkage, chromatin condensation, nuclear dissolution, nuclear fragmentation. So can you match this and tell me the appropriate answer? So those who haven't gone through the text, I'll just read out the options for you. On one side of the column you have pycnosis, karyorrhexis, karyolysis. On the other side you have nuclear shrinkage, chromatin condensation, nuclear dissolution, nuclear fragmentation. So match the following based on their appropriate meaning and sense. Hi Kiran, a very good evening. Yes, pycnosis. Pycnosis, we'll get back to pycnosis later. Karyolysis is nuclear dissolution, right? Karyorrhexis is hexis, fragmentation, nuclear fragmentation. Whereas pycnosis is both A and B, nuclear shrinkage as well as chromatin condensation, right? So if you observe, pycnosis, both nuclear shrinkage and chromatin condensation are appropriate. Karyorrhexis is nuclear fragmentation and karyolysis is nuclear dissolution, right? A very simple match the following, but you should be very clear in understanding these terms, right? So all of these are various irreversible nuclear changes which are seen in case of necrosis, as we have discussed n number of times previously. Okay, fine. Yes, Anu says, no sir, not on mail. You do let everyone know that. Yeah, the trip, definitely I'll let everyone know. There is no secret in this. But if you have, I don't know what you are actually planning to. So based on your customized plan, I can guide you accordingly in mail. That's my point. So there is no secret here. Yeah. So we'll go ahead with third question. Good. So third question, I've given you a statement and 4 options. So I'll just pause a minute because we're having some disturbance. Yeah, a vascular cellular response to tissue injury resulting in isolation of a causative agent, elimination of necrotic cells and tissues, and host tissue repair is injury, infection, necrosis, apoptosis. So which of the following terms fits into the description given in the question? Yeah, a vascular and cellular response to tissue injury resulting in isolation of a causative agent, elimination of necrotic cells and tissues, and promotes host tissue repair. So which of the following terms fits into the description? Injury, infection, necrosis, apoptosis. Apoptosis, as you know, is a programmed cell death, right? So it's a trap. Option E, none is right answer. So this is a description of the classical term inflammation. As you know, inflammation is a localized response of a vascularized living tissue to some kind of noxious stimuli in order to eliminate or isolate the causative agent and promote host defense or to promote tissue repair. So this is a definition of inflammation. Option E, none is right answer. Right? I hope you got it. Okay. It's drizzling and my notes and laptop are getting wet, so I have to conclude this session as soon as possible if I have to save these devices and notes. Okay, granuloma. Fourth question, penultimate. Granuloma is a benign tumor, a malignant tumor. So this was exactly the same kind of question which one of our professors asked us during our UG in our second year BDS. So granuloma is a type of benign tumor or malignant tumor. Shivanand, you can just check out the title of this video. Right now we are in a place called Fiesch. I'll describe about this place in our street view session, which will start the moment we conclude this discussion, right? So I again see most of you falling in trap. Granuloma, since you have oma at the end of the word, doesn't mean it's a tumor. It's not a tumor. It's not a benign tumor. It's not a malignant tumor. Granuloma is granulation tissue. You have neoangiogenesis, sprouting blood vessels. You have fibroblasts everywhere. You have inflammatory cells in specific or predominantly epithelioid cells and multinucleated giant cells. Granuloma is not a tumor. It's not a benign tumor. It's not a malignant tumor. You have granulomatous inflammation, tuberculosis, leprosy. You might have studied about granuloma with a central caseating material in case of tuberculosis, right? So granuloma is none. I hope you got the answer. Yeah, few of you have answered it. It's a part and parcel of healing process, trying to ward off the infection, the causative agent. Good. So final question. Okay, my notes is almost wet. Because there is a slight drizzle. It's a combination of drizzle with snow. Last one. Primary mediator of anaphylaxis. Which of the following is a primary mediator of anaphylaxis? Prostaglandins, leukotrienes, histamine, all of the above. So I saved my notes. I have to save my laptop. Okay, Saranya. So which of the following is a primary mediator of anaphylaxis? Prostaglandins, leukotrienes, histamine, all of the above. Remember, prostaglandins, their function or they're involved in pain, fever, as well as vasodilation. Whereas leukotrienes, they increase vascular permeability. Most importantly, they are primary mediators in case of asthma, right? Asthma. The primary mediators are leukotrienes. Whereas the primary mediators in case of anaphylaxis, IgE mediated release of histamine. So which cells release histamine? You're right, histamine is the right answer. Histamine is a primary mediator in case of anaphylaxis. IgE antibodies involved. That's one of the questions which we discussed in study club previously, last week. So, histamine is released by which of the cells, which of the inflammatory cells, and what are the functions of histamine? We'll conclude with this question. I'm sorry. Yes. Mahesh Babu, mast cells, basophils. Mast cells and basophils release histamine. And what are the functions of histamine? Wonderful. So what are the functions of histamine? Yes? Increase vascular permeability, vasodilation, bronchial constriction, and primary mediator of anaphylaxis. Vasodilation increases vascular permeability. Very, very important. Yes, in case of bronchi, they cause constriction, right? Yeah, I know. Since we are outside, so audio will be comparatively weak. I'm not using any microphone, so if possible, please use headphones, right? Yes, bronchial constriction, wonderful. So, see, always remember, we have to strengthen our basics, because if we commit any mistake in basics or in the questions which we already know, then it should be considered as a sin. So always be thorough with your basics, and these final 10 to 15 days or 10 to 12 days maximum, try to focus on revision, consolidating your memory. Try to focus on going through your notes, strengthening your concepts once again, rather than altogether going for new topics, right? So I hope you got the answers for all the questions and related points pertaining to those questions. So this is pertaining to certain key points from pathology. So we'll have as many sessions as possible, as I mentioned last week. So we'll try to have as many sessions as possible along with general subject discussions, right? I hope it's clear. Okay, we'll just take a very short break, 2 to 5 minutes. I'll make some arrangement and then we'll go for a street view, right? Okay then, see you. Have a nice day. And It's 7:15 p.m. I think we have concluded the session very fast. So we'll see you again in 2 to 5 minutes time. Love you all. Bye. Yeah, check out for new link in our WhatsApp update group. I'll post the new live link.